everyone, it's me Jiveria Jabin and welcome to our YouTube channel. Today we are going to understand the anatomy of the heart with the help of an animation. And at the end we will undergo a quiz for the self-analysis.
Here we look at the heart. The heart is a conical like a pyramid muscular organ which is placed in the middle mediastinum and enclosed by the pericardium. It is placed obliquely behind the body of the sternum and the costal cartilages. So we will study the structure of the heart by correlating with the conical pyramid. The posterior surface of the heart forms its base and it is quadrangular in the shape, and the inferior surface of the heart faces the diaphragm and forms the diaphragmatic surface. Beside diaphragmatic surface, the right and left pulmonary surfaces are the present. And then comes to the anterior surface of the heart, which is also called sternocostal surface, as it faces the sternum and the costal cartilages. So now let's discuss each surface in detail. Let's start with the base of the heart, which is the posterior surface, which is mainly composed by the left atrium and the right atrium of the heart. The proximal part of great veins like superior vena cava and pulmonary trunk is also seen, and it is separated by the diaphragmatic surface by coronary sulcus, in which coronary sinus and coronary arteries are the present. Then comes to the diaphragmatic surface of the heart, which is mainly formed by the left ventricle and the right ventricle. Then comes to the anterior surface, which is formed by the right atrium, right ventricle and left ventricle, and the left auricle is also seen slightly on the anterior surface, which is also called the sternocostal surface. Now let's have a look on the sulcus or the grooves which separates the chambers of the heart. First is coronary sulcus, which separates the atria and ventricles of the heart. In coronary sulcus, the right coronary artery, the circumflex branch of left coronary artery, and the coronary sinus is the present. Secondly, discuss the anterior interventricular sulcus, which separates the right and left ventricles on the anterior surface, and it contains the greater cardiac vein and the anterior interventricular artery. Posterior interventricular sulcus separates the right and left ventricle on the posterior surface, and it contains middle cardiac vein and posterior interventricular artery. At last, talk about the interatrial sulcus, which is not observed on anterior or inferior surface but is faintly seen on the posterior surface, and it does not contain any vessel. So we have all done about the external structure in the anatomy of the heart. Now we are going to have a look on the internal structure, which is observed after the dissection of the heart. Okay, so human heart has 4 chambers. The upper 2 chambers are called right atrium and left atrium, while the lower chambers are called right ventricle and the left ventricle. The membrane between right and left atrium are called interatrial septum, and the membrane between ventricles are called interventricular septum. The opening between right and left atrium is guarded by the tricuspid valve, as it's clear from its name that it has 3 cusps or 3 leaflets. The opening between the left atrium and left ventricle is guarded by the bicuspid valve, as it has 2 cusps or 2 leaflets. The bicuspid valve is also called mitral valve. These are atrioventricular valves of the heart, and their opening and closing is controlled by the fibrous tendons, which is called cordia tendinae. These arise from the papillary muscles, and papillary muscles further arise from the walls of the ventricles. The opening and closing of these valves makes the sound of lub and dub, and lub dub is heard as a heartbeat sound by the stethoscope. The opening of pulmonary trunk and the aorta is also guarded by the valves, which is called pulmonary valve and aortic valve respectively. These valves, aortic and pulmonary valves, are called semilunar valve because it looks like a moon. These valves prevent the backflow of blood from the vessels into the ventricles again. After knowing about the valves of the heart, now have a look on the walls of the heart. So the thickness of the walls of the heart vary with their function. The atrial valves are thinner as compared to the ventricular valves. Because the atrial valves has to pump the blood just into the ventricles, but the ventricular valves has to pump the blood into the body, and in comparison between the right and left ventricle, the left ventricular valve is more thicker as it has to pump the blood into the whole body by the aorta. Now understand that how the heartbeat of the heart is maintained. So there are some nodes like sinoatrial node, which is called SA node, and atrioventricular node, which is called AV node, and some bundles of HIS, also the Purkinje fibers. These are all the cardiac tissues, specialized cardiac fibers, which are auto excitable and maintain the heartbeat without the need of any external stimulus.
I hope that this animation and explanation makes your concept so clear. So this is the time for self-analysis. So let's move to the quiz.
Question number 1. Which chambers form the posterior surface of the heart? And the answer is right and left atria. Question number 2. Which structure of the heart controls the opening and closing of atrioventricular valves? And the answer is caudate tendini, which arise from the papillary muscles. Question number 3. Coronary sulcus contain which branch of left coronary artery? And answer is circumflex branch of left coronary artery.
I hope that this video is helpful for you, so must like, share and subscribe. And if you are also interested to know about the flow of blood in the heart or the blood circulation, which includes pulmonary circulation and systemic circulation, so I have already prepared a video, link in the description, so must go and watch it. See you in the next video. Thank you. Allah Hafiz.